Well, what's different about the testing is the fact that the results are not always valid. What we've shown in our research over the years is that 40% of the providers doing the testing within the workers' compensation market do the testing below what we'd consider to be an acceptable level, and that the people working on these cases, the nurses and the adjusters, often have no idea that that's the case. They accept the results as being accurate and being the truth. What exists in the United States is that the national standards are not enforced in any way. When we set up our network 15, 16 years ago, one of the things we wrestled with is that there was no consistency in how the testing was done. So we became the first entity in the United States that actually credentialed physicians based on their training and the quality of their report forms. So amazingly, I'm in 50 or 60 different networks in my neurology practice. In New Jersey, One Call still to this date is the only network that's ever credentialed me in any way. A misdiagnosis leads to either unnecessary or inappropriate treatments. Inappropriate surgery leads to extended disability or additional surgeries, so that the danger exists not only to the patient, but in an area like workers' comp, the cost can be enormous. It's a several-prong approach. Number one, we allow only neurologists and physiatrists in our network. So that's consistent with the AANEM guidelines. Number two, we credential the physicians. So we've set up standards that we follow, and then we make sure that physicians adhere to our standards. And next, we set up years ago a nationally recognized board that's made up of former presidents of the AANEM to give validity to whatever we say are our standards. So setting up that program assures that there's consistent quality and allows us to have the best physicians in a certain geographic area doing the predominance of the cases. Through the board and through the leadership of One Call several years ago, we established a program called QR, or Quality Review, that gave the adjuster or the nurse after the fact to send in a report to see if it adhered with the standards and to see whether the results were based on valid results. If the QR deems that the test is not what we'd call medically useful, it gives the adjuster or the case manager the ability to put a hold on treatment and even repeat the test if required.